So, dear colleagues, today we'll have the next lecture, and it will be about the use of psychoactive substances. And you have to understand one main specific feature, that it doesn't matter where you will live, in the Europe, in the Asia, in the Egypt or other Arabic countries, or in Africa, you will meet the people who will have problems with the psychoactive substances. It means that you will meet the people with the dependencies, and in our days, it's one of the most problematic thing that can be met by each doctor. We know that during many years, people take psychoactive substances, and typically they take them because they want to relax, they want to have some fun. And in the brain of these people, there is a thought that psychoactive substances can help them to make better recreation. It means that they use the psychoactive substances in the recreational level. In some cases, this recreational use become or is only recreational. In some cases, it will become the dependent type of the use. And in this case, these people and their relatives and friends and the social will meet a lot of problems and a lot of mental, social, and occupational problems. We know that most of these substances that are taken by the people, they have the capacity to produce the tolerance and the withdrawal. In some cases, these substances will not have these things, but we have to say that you have to understand the main features that can be present in this type of disorders. So if you're talking about the dependencies, we have to say that it's acquired urgent need to take any action or to use any psychoactive substance. If we will try to explain, we can say that in the practice, this term can have the several meanings. So looking on this explanation, we can see that there are two main types of the dependencies. If you're talking about the performing or making some specific actions, we are talking about the non-chemical dependence. And if you're talking about the use of chemical substances, we can say that there is chemical dependence. So in which case we are talking about the chemical, and in which case we are talking about not chemical dependence. Chemical dependence is dependence during which the person take any psychoactive substance from the outside of the body, put it inside of the body, and it leads to the changing of the work of the brain. Why it changes the work of the brain, you will understand a little later. In the chemical dependencies, we are talking about the alcoholism, about the drug addiction, and about the substance abuse. Non-chemical addiction, in this case, people typically perform specific actions. For example, they play games like cards, like casino. They prefer being in the internet. Some of people can be shopaholics. It means that they buy things that are not useful in their life. There are sex addiction, workaholics. Workaholic is people that work too much, and even if this pathological work leads to the social, mental, physical disorders, people still continue working. It's television dependence, sport dependence, and religious dependencies. So looking on the non-chemical dependence, we can say that in this case, people perform specific scenes, and these scenes, they lead to the changing of the work of the brain. If we want to talk about dependencies, we have to say that in the chemical dependencies, we are talking about the psychoactive substances. It's substances that, when are taken or admitted into one system, affect mental process, for example, cognition, for example, well-being, mood, or other states. On this picture, you can see a lot of psychoactive substances. It's cocaine, it's crack, it's methylphenidate, ephedrine, it's mushrooms, bupropion, cannabis, and other things. When we were talking about the chemical and non-chemical dependencies, we were talking about the specific influence on the brain. And it's the main thing that leads to the dependencies. We know that all psychoactive substances, they affect of the work of the human brain. In some cases, they can accelerate the transmission of the sensory signals. In some cases, they can prevent nerve centers from performing their functions. The effects of psychoactive substances are based on their effect on the neurotransmitters. It's substances that transmit signals from the one neuron to another. So if we are talking about the chemical ones, we know that substance that is taken from the outside of the body, put inside of the body, and lead to the changing of the work of the brain. If we are talking about the non-chemical dependencies, in this case, performing of specific actions lead to the changing of the work of the brain. And it is changed because of the effect on the neurotransmitter. So it means that both types of dependencies, they lead to the changing of the work of the neurotransmitters, and it means that they will change the work of the brain. All psychoactive substances, they can be divided into two main groups. It's toxicomanic and narcotic substances. Why do we need to talk about these two types of substances? Because we know that people who use psychoactive substances, they can have the problems with the law. You will have the problems with the law if you use or if you have the narcotic substances. If you have toxicomanic substances, you will not have these problems. So for better understanding, there are three main criteria for which satisfy narcotic substances, and two of them satisfy toxicomanic things. It means that narcotics, they are illegal. It means that if you will have, if you will sell, if you will buy narcotics, you will have the problems with the law. If the substance satisfies the medical criteria, the substance must have specific effect on the central nervous system, which is the reason for its non-medical use. For example, it can be stimulating, calming, hallucinogenic, or other effects. Social criteria says that people which use psychoactive substances, they have social problems. It means that they have problems in their families, they have problems in their work, they have problems with their friends. It means that almost all spheres are disordered because of the use of these substances. So toxicomanic substances, they satisfy only medical and social criteria, and if you're talking about the narcotic medications, they satisfy also the legal criteria. We know that almost all people that use psychoactive substances, they will have the physical and psychological dependence. What does it mean? It means that if you think that you will take any psychoactive substance and it will not lead to the problems, you are not correct in this situation, because potentially you will be dependent. What is physical dependence? Physical dependence is specific condition that is caused by the chronic use of the tolerance-forming drug, in which the abrupt or gradual drug withdrawal causes the unpleasant physical symptoms. What does it mean? It means that physical dependence, it's a physical condition that is caused by the withdrawal of any specific substance. It can be the withdrawal from the opioids, antiepileptic medications. In some cases, the antidepressants can have the withdrawal symptoms. And it means that people typically continue taking the substance because of these withdrawal syndromes. It means they don't want to have unpleasant, negative physical effects. If you're talking about the psychological dependence, we are talking about the emotional, motivational negative symptoms. It can be the anxiety, the anhedonia, the continuous thought about the use of psychoactive substance. Physical and psychological dependencies, they are the main problems if you're talking about the use of psychoactive substances. And if we are talking about these two types of dependencies, we can say that there is specific difference between them. If you're talking about the psychological dependence, we have to understand that it causes the emotional, motivational, withdrawal symptoms. And if you're talking about the physical dependence, as a rule, we are talking about the specific somatic symptoms. For example, increasing heart rate, it's sweating, it's tremor, it's vomiting, it can be nausea. So it means that it's specific physical symptoms. If you're talking about the physical dependence, we are talking about that the body has altered in the way that create craving for the drug. For example, to end withdrawal symptoms. In psychological dependence, person resources for coping with daily life, whether a drug becomes needed to relax, socialize, or sleep. What does it mean? It means that if you're talking about the physical dependence, we are talking about the stop of specific negative symptoms, physical symptoms, when the medication is used. If you're talking about the psychological dependence, we are talking about specific mental processes. For example, the person, if it doesn't use the medication, feels extremely unhappy, feels that the life does not have normal colors, feel that there are not enough emotions. In some cases, it can be depression. In some cases, it can be the anxiety. And for normal social level of functioning, these people need to use these psychoactive substances. Another specific feature of the psychoactive substances, it's the ability to form the tolerance and the withdrawal symptoms. What is tolerance? Tolerance is said to occur when the patient has to take ever increasing amount of the substance to get the desired effect. What does it mean? It means that if the person use weed, for example, cannabis, or if the person use amphetamine or alcohol, the first time, the dose of the psychoactive substances is typically low, extremely low. So you need small dose to get desired effect. If the person uses psychoactive substance for long periods of time, in these cases, the person has to increase the dose to get the desired effect. And from the opposite side, the person needs, if the person uses the same dose as previously, for example, the small dose, it will lead to the not enough effect. It means that the person will not get desired symptoms. We know that most of people who are dependent from the narcotics, they die from the use of extremely high doses of the psychoactive substances. Why does it occur? It occurs because the symptoms of tolerance. What does it mean? It means that if the person used for years, for example, opiate, the dose that leads to the psychoactive effect and the dose that leads to the death, is the difference between these two doses is extremely low. And it means that the person, if the person continue using this psychoactive substance, it can potentially lead to the death. We are talking about the symptoms of withdrawal when the person discontinued the use of psychoactive substance, or sometimes when the dose is not enough. And as a rule, it leads to the specific negative effect. It can be tremor, it can be physical symptoms like nausea, vomiting, palpitation, it's heart beating, it can be muscle aches, it can be heartache. And it can lead to the mental symptoms or psychological symptoms like irritability, decreased mood, inability to concentrate, inability to sleep. And these withdrawal symptoms, they become the main reason why people continue taking psychoactive substance. Because without psychoactive substance, the person cannot live normal life as before taking the psychoactive substances. The typical withdrawal symptoms can be like cold shakes, chills, sweating, fever-like symptoms, mood swings, anxiety and depression, bone pain, vomiting, insomnia, and diarrhea. For example, today I had a patient. She's a young, beautiful girl. She's 27 years old. She's extremely beautiful. And in the previous history, she were taking the amphetamine for a few years. And near 1.5 years, she were taking amphetamine every day. It means that she is a dependent person. In the past, she didn't use psychoactive substances for 1.5 years. And for example, today we were talking about some specific things about her life, and she told one interesting thing. She told that her life becomes better. She logically understands that her life is very good, but there is one but. This but says that life is not so emotional as it was before. When I asked what does it mean that it is not so emotional as it was before, she told when I were using psychoactive substances, I had a lot of emotions. Sometimes I were unhappy, sometimes I were extremely happy, and I had this like moving of the emotions. And she told I want them, these emotions, because in the normal life, when you go to the work, when you earn money, when you have relations with the boyfriend, when you have the dog, it's like everything is very stable, and she does not enjoy this life. So she wants to do something with her life, to have more emotions, but logically she understands that it's the best way of living. If you're talking about the history, we can say that in the past, these phenomena of tolerance and withdrawal, they have been termed as physiologic dependence. However, because of the word dependence, often conjures up the image of addiction, another term, neuroadaptation, has been coined. Neuroadaptation is clearly the preferred term for two reasons. First, it speaks to underlying neurological mechanism, and the second, it is neutral with respect to the addiction, thus emphasizing that tolerance and withdrawal. So, because in addiction can also occur with abusive use, occasionally with the recreational use, and also during appropriate medical treatment. If we will look on this slide, we can see that there are specific symptoms of nicotine withdrawal. The first and the main problem is the urge to smoke or craving. It's restlessness or difficulty in concentrating, difficulty sleeping, irritability or anger, anxiety or low mood. Less common nicotine withdrawal symptoms are cold symptoms such as coughing, sore throat, and sneezing, constipation, diarrhea, stomach ache, and nausea, dizziness or feeling lightheaded, mouth ulcers can also be the symptoms of nicotine withdrawal. In some cases, it can be other symptoms. We know that if you look on the average person, we know that in some period of life, this person can have the experiments with the psychoactive substances such as caffeine, nicotine, alcohol, cannabis, and during the last days, more frequent people use cocaine and other psychoactive substances like amphetamine. We know that some people cannot live without the morning cup of coffee, and social drinking, they are also typical examples of these dependencies. In some cases, the substance produces some sort of dysphoria, and the person never uses it again. What does it mean? It means that the first use of psychoactive substance, it's the use that potentially can lead to the development of dependence or cannot lead. If the person use the first time the psychoactive substance, potentially it can lead to specific positive symptoms. If the person feels these positive symptoms, in this case, the brain understands that you have to continue taking this substance, because if you're talking about these positive symptoms, we can say that they cannot be made by any other thing in the life except psychoactive substance. It means if the person uses some psychoactive substance, have positive effect, in most of the cases, it will lead to the development of the dependence. If the person uses psychoactive substance and does not have the positive psychoactive effect, for example, if the person have paranoia, if the person have heart beating, if the person have feeling that he's dying, for example, in this case, it not in 100%, but the ability to be dependent decreases in many times. We know that most of teenagers, they smokes marijuana and they can become paranoid. In other cases, some teenagers can smoke marijuana one time, have become paranoid, and other time become more communicative, more happy. And in this case, the ability to become dependent is higher than in the average population. Most of people, they believe that they can control the use of psychoactive substances, and they believe that they can stop in any moment. But if we will look on the statistic, we can see that most of people that start taking psychoactive substances, they cannot stop doing it. For example, in the case of caffeine or alcohol or cannabis, and in some cases, for example, some hallucinogens, phencyclidins, people use these substances in the recreational level. Also, progression to abusive use may occur with any of these. A progression from the recreational to abusive use appears more common for tobacco, psychostimulants, especially cocaine and opioids. The likelihood of this progression is increased with the intravenous use or with smoking crack cocaine. It means that the use of psychoactive substance can also lead to the specific effect on the brain and ability to develop the dependence from the psychoactive substance. Some cases of the psychoactive substances use can lead to the development of the dependence, and this progression of use is due to the peer pressure. In other, it can become a neuroadaptation that has occurred, and the relief use seems highly desirable. And in yet a third group, abusive use may occur either because of the person gets substantial enjoyment from the substance or because it helps the patient to cope with the life's problems. The modern literature says that the main reason why people become dependent from the psychoactive substances is the state that occurs when they use them. We know that it's the state of the changed consciousness. So people are running for this specific state. It's state when the life becomes another, when your thought become another, and when everything changes in the life. Peer pressure, for example, is particularly important among teenagers and the young adults. For example, when everybody is using psychoactive substances like cannabis or alcohol, you want to be one of the crowd, and these people go alone and use more than might be the case if left to their own devices. The need for the relief may use many occasionally prompt use beyond that which the patient wishes. So if the person wants to get relief, in this case, this starts from the use sometimes, for example, once a month, so then one is 2 weeks, and 1 week, and it leads to the making of the dependence. If you're talking about the addiction, we can say that these patients experience the overwhelming compulsions to use a substance and are driven by the compulsions to repeated use despite the most disastrous consequences. Despite repeated attempts to control their use by moderating it or stopping it altogether, addicts find themselves again and again intoxicated. The appearance of the craving may be gradual and insidious, or at times acute, but in the history of every addict, it is time when the crosses the line and is no longer able to stop. Once craving develops, denial becomes severe. Eventually, substance use becomes the primary, if not the sole, motivating factor in the patient's life. As a rule, family, friend, the work pale by importance, and all the patient's effort become directed to one thing: ensuring an unbroken supply of the substance. Speaking about that features that the substance become the main part of the life, you have to remember the beginning of the lecture when you were talking about the increasing of the tolerance, about the withdrawal symptoms. It means that from the one side, the person wants to stop taking the psychoactive substance, but if the person stop taking psychoactive substance, they have the withdrawal symptoms, physical and psychological symptoms, and it leads to the thing that they are unable to live normal life. So they have to use the psychoactive substance. From the other side, continuous use of psychoactive substance leads to the increasing of the tolerance. It means that the person needs higher and higher doses of psychoactive substance. For example, if on the beginning of the use of psychoactive substance, it does not cost a lot, if the person can use, for example, once a month psychoactive substance, on the later stages, people can use several times a day, and it means that they need big amount of money, big amount of psychoactive substances, and they waste a lot of time for the use of psychoactive substances. It means that they waste all their life, or all their life is going around the psychoactive substance, and they doesn't have something else. On this slide, you can see the dependence potential of psychoactive substances. We know that there is pleasure, psychological, and physical dependencies. So on the first place, it's heroin. The second place is cocaine, and on the third one is tobacco. Then barbiturates and alcohol, benzodiazepine, amphetamine, cannabis, and ecstasy. So looking on this slide, you can understand which substance can lead to the dependence more quicker than other ones. We know that the most widespread psychoactive substance in the whole world is alcohol. And speaking about the alcohol action, we know that it affects virtually every organ and system in our body, and in the high doses, it can cause the coma and the death. It can affect different neurotransmitter systems, and it, as a rule, includes the opiates, the GABA, the glutamate, serotonin, and dopamine. If we are talking about the increased opiates level, it helps to explain the euphoric effect of the alcohol. While if we have the main effect on the GABA, gamma-aminobutyric acid, it causes the anxiolytic and sedative effects. Alcohol inhibits the receptors of the glutamate, and we know that the long-term ingestion results in the synthesis of more glutamate receptors. When alcohol is withdrawn, the central nervous system experiences the increased excitability. Persons who abuse alcohol over the long term are more prone to alcohol withdrawal syndrome than people who have been drinking for only short periods. Brain excitability caused by long-term alcohol ingestion can lead to the cell death and cerebellar degeneration. It can lead also to the Wernicke-Korsakoff syndrome. It can lead to the tremor, alcoholic hallucinosis, delirium tremens, and withdrawal seizures. If you're talking about the opiate receptors, they are also increasing in the brain of the recently abstinent alcoholic patients. And the number of receptors, it correlates with the craving for the alcohol. What does it mean? It means that in our brain, there are receptors. It's specific cells that have ability to communicate with some substances. Cells between each other are communicating with the psychoactive substances. It means that if there are a lot of substance beside the cells, in this case, there are a lot of receptors, specific cells that take the information from this chemical substance. If the substance decreases, and still there are a lot of receptors, it means that every receptor wants this psychoactive substance. And in this case, we feel the craving. It means we feel the desire to take the psychoactive substance, and it leads potentially to the craving to the alcohol. If we are talking about the alcoholism, we are talking about the alcohol dependence. It's the common disorder. At all ages, alcoholism is more common among the males than the females. However, given the somewhat later age of the onset in the females, the ratio tends to decrease in the higher age groups. In our days, the overall ratio is probably 3:1. It means that 3 men to 1 women. For example, near 20 or 30 years ago, the overall ratio was near 6:1. It means that it decreases. And looking on the last years, I can say that there is very interesting statistics. For example, when I were studying at school in the last years, when I were studying on the first courses of the medical university, there were only a few sorts of beer in our shops. So if we will come to the supermarket right now, we can see 100 different types of the beer and other low alcoholic drinks. Speaking about the men, as a rule, they are drinking high alcohol drinks. And speaking about the women, as a rule, they are drinking low alcohol drinks. If there were no alcohol previously, low alcohol drinks previously, now you can find everything that you want. If you want with the taste of banana, here you are. If you want the strawberry taste, here you are. If you want with the cola taste, here you are. Yeah, you can choose any taste that you want, and it leads to the thing that women start drinking more alcohol, and potentially it leads to the increasing of people who become dependent. What is the statistics of the alcoholism? We know that near 10% of the population, they are problem drinkers. It means in the European countries, in the USA, and, for example, in Ukraine also. We know that alcohol is the most widespread illicit drug for teenagers. If you're talking about the overall, it's marijuana. 15% of all car accidents and 50% of the pedestrian accidents, they occur in the intoxicated state. On this slide, you can see the specific scheme of working of the alcohol. Yeah, you can see. Okay, I think that you don't need it. So if you're talking about the onset of the alcoholism, we can say that as a rule, a lot of years has to pass before that moment when people understand that somebody have the problems with alcohol. As a rule, we are talking about the onset that starts on the late teens or early 20s. However, the most alcoholics are not recognized in this year. And as a rule, they are recognized as a rule in the late 20s or even 30s. And it become a big problem. Why does it become a big problem? Because on the first stages of alcoholism, people does not have highly developed social and medical problems. It means that on these first stages of alcoholism, as a rule, people cannot be recognized, and it leads to the thing that they become dependent more and more. And if you're talking about the dependence on the later stages, it's more difficult to treat people. We know that in some cases, the alcoholism can occur even in the patients who over the 60 years, and it's but if you're talking about the statistic, it rarely occurs in people who are more than 45. What are the main clinical features of the alcoholism? The first feature is the urge to drink that is experienced as a craving, as imperious need, or a compulsion. What does it mean? Craving, imperious need, or compulsion, it's specific thought that comes into the head of the person and continue again and again. This thought is more stronger than the person, it belongs to the person cannot do nothing with this thought, and this thought leads to the anxiety. If it will not be satisfied, the person will be very anxious and will not be able to relax until that moment when he or she will continue drinking. We know that almost all alcoholics, they deny that they have any problem with the drinking, or they rationalize it one way or another. For example, they say that I'm drinking because of the problems on the job. I'm drinking because I don't have ability to earn enough money, because of health problems and other things. They are often quick to lay blame for their drinking on the situations of other people. We know that when the stressful events occurs in the life of the alcoholics, they are followed by the increased alcohol consumption. And the alcoholics, they also intoxicated state. They can be also in the intoxicated state when they have good periods of time, or even neutral periods of time. So it means that alcohol use, it's seen that occurs without any specific reason. We know that most of people who have dependence from the alcohol, they make attempts to control their drinking, and also they may have some success. But if you're talking about the success, we know that it is very short-lived. This short-lived success, we can say that it is inability to control the use of alcohol, or we can say that it is the main problem of the alcoholism. It's loss of control. It means that if the average person does not need to control their drinking, the alcoholic has to think every time, will I drink or I will not drink? If you want to drink, if you don't have alcoholism, you can drink or you cannot drink. Alcoholic cannot think about I cannot drink. Alcoholic always wants to drink. When alcoholics start drinking, they, as a rule, are unable to stop. So it means they typically become intoxicated, and this recurrent intoxication eventually brings their lives in their ruins. You know that most of alcoholics, they have problems with their friends, they are lost, they have problems with their health, marriages are broken, the children become abused, the jobs are terminated, and even looking on these events, alcoholics still continue drinking. We know that a lot of people who are drinking alcohol, they have changes in personality. It means that alcohol leads to the specific changes of the person. Previously, upstanding individuals may find themselves lying, cheating, stealing, and engaging in all manner of deceit to protect or cover up their drinking. Shame and remorse the morning after may be intense. Many alcoholics, they progressively isolate themselves to drink undisrupted. An alcoholic may hole up in a motel for days, for a week, drinking continuously. Most alcoholics, they become more irritable. They have heightened sensitivity to anything valued critical. Many alcoholics appear quite grandiose, yet on closer inspection, one sees that their self-esteem has slipped away from them. Near one day ago, one of our students, the first year student, but it's not the foreign student, he came to our department for the consultation. It happened because in one of the days he started drinking, and he was drinking during a few days. It were the Thursday, Friday, Saturday, and Sunday. On the Sunday he was drinking alone, and on Sunday he took the knife and he were running after people with this knife. He were argued with people, he were conflicting with people, and the police came and took him to the narcological dispenser. When we talked with this guy, we knew that he were taking some specific psychotropic medications, and this specific use of medications lead to the pathological alcohol intoxication. So he had the changes of the consciousness. It means that he did not remember the events that were during his inadequate behavior. In some cases, the use of alcohol can become as a result of having any mental diseases. Rule, it's anxiety disorders, it can be bipolar disorder, depressive disorders, or other psychotic disorders. We know that most alcoholics, they display an alcohol withdrawal syndrome when they either reduce or temporarily cease consumption. Awakening with the shakes and with a strong urge for the relief drinking is a common occurrence. Many alcoholics, they eventually succumb to the morning drink to reduce their withdrawal symptoms. It seems that we were talking about that even if the person wants to stop drinking or to use psychoactive substance, withdrawal symptoms lead to the things that they have to continue doing it because they cannot function normally, and it becomes the main reason why they are doing it. Some degree of tolerance occur in all alcoholics. For example, if on the first stages of alcoholism, people can drink 100-150 milliliters of strong alcohol, on the later stages, it can lead to the drinking of 1.5-2 liters of strong alcohol. It means that the tolerance can increase even in 10 times or sometimes even more. So speaking about this tolerance, we understand that the alcoholic has to use larger or bigger amounts of the substance to get the desired effect or to be intoxicated. The intoxicated patients is a familiar sign in many emergency room, and the determination of a blood alcohol level is commonplace procedure. If you're talking about the blood alcohol level, we can say that it's milligram per deciliter, or it is often charted milligrams per cents. Roughly speaking, if you're talking about the 70-kilogram person, the blood alcohol level can rise anywhere from 15 to 25 milligrams deciliter with every 15 milliliters of rapidly ingested pure ethyl alcohol. So if you're talking about the pure ethyl alcohol, we know that it has more than 90 or 96% of alcohol. If you're talking about the whiskey, vodka, it has near 43-45 degrees of alcohol. Yeah, if you're talking about the wine, it's near 10%. So you can imagine what does it mean. This amount of ethanol is found in one bottle of beer or about one glass of wine. Given that most social drinkers or alcohol naive persons become intoxicated at blood alcohol level of 100 milligram deciliter. simple arithmetic shown that for such person only about 4 drinks or beers or glasses of wine are required to produce the intoxication. Speaking about the alcohol intoxication, we know that there are 3 degrees. Mild alcohol intoxication in most individuals leads to the euphoric effect, but in some cases it can lead to the presence of the suspicious symptoms of the paranoia, of the persecution. And sometimes people can become depressed, tearful, and morose. But as a rule, as we told before, people have the increasing of their mood and they have feeling of pleasure. And this euphoric effect is the main thing why people want to drink alcohol. As a rule, people start talking more, they tend to shed their inhibitions, they become more sexual, they become less become more confident about themselves, and people feel better. If you're talking about the moderate alcohol intoxication, we are talking about the behavior that tends to become coarse. Inappropriate commonplace thinking is getting slower, inattentiveness occurs, the person is slow in the responding to anything. Even if the person is in the dangerous situations, still the person cannot react normally. The face is flushed, the conjunctives are reddened, and the pupils are dilated. Slurred speech, nystagmus, ataxia, and generalized incoordination can be present in this stage of the alcohol intoxication. If you're talking about the severe alcohol intoxication, as a rule, we are talking about the disorders of consciousness. As a rule, it's stupor or coma. Stupor, it means that the person cannot have normal reactions to the surrounding. As a rule, they have inability to move normally. They, as a rule, does not answer normally. As a rule, these people start vomiting. They cannot move. They are laying somewhere. If we are talking about the presence of stupor, and if we will not clean the person's blood, as a rule, the alcohol is ingesting more and more, and it can lead to the presence of coma. Why are we talking about the alcohol coma? We are talking about the alcohol coma because it occurs because of the very high alcohol level. We know that there is a hematoencephalic barrier. It's specific barrier that does not give ability to toxins to go to the brain and to kill the nervous cells. Speaking about the alcohol, we know that it can go through the hematoencephalic barrier. It means that it can go to the brain and kill the nervous cells. Speaking about the brain, we know that it is situated in the skull, and the skull has specific volume and it cannot be increased. From skull, we have only one big hole that can lead to the going out of the brain from the skull. It's foramen magnum, a big occipital hole. Yeah, and we know that in this foramen magnum there is a longitudinal brain that is connected with the spinal cord. If the brain become more and more tumor, in this case, the longitudinal brain can go through the foramen magnum, and it will lead to the inclusion of the longitudinal brain in this hole. We know that in the longitudinal brain there are centers of the heart beating, of breathing, and other specific centers that are very useful in our life. And understanding this feature, we know that the person can die in the alcoholic coma if we will not help this person. So it's very necessary to understand that if the person have disorders of consciousness during the alcohol use, you have to call to the ambulance and you have to help the person to cope with this situation. Speaking about jokes, in Ukraine, for example, we have joke that if you have a party and you remember everything that occurred during the party, it was a bad party. We are talking about the palimpsest. This loss of memories on the events that were during the alcohol use, they have specific name, blackouts or palimpsests. They are characterized by a dense anterogradic amnesia. During the blackout, the intoxicated individuals appear outwardly unchanged. However, for the duration of the blackout, events fail to enter their memory. After coming to, these individuals have no recollection of what was said or done during the blackout. Also, the vast majority of blackouts occur during the alcohol intoxication. They may also occasionally be seen in the intoxication with other sedative hypnotics and the particular high potency benzodiazepines. Importantly, also most patients with the blackouts are alcoholics. This is not always the case, as blackout may also occur in the social drinkers who simply consume more than is typical for them. Upon the recovery from the blackout, drinkers often recount that they remembered everything up to a certain time and then went blank. Some patients go to sleep during a blackout, and when they awaken, they wonder how they get to home or go to bed. And as a rule, they wondered what are these people doing with them. Upon recovery from the blackout, most patients are worried about what they did during the blackout. The car may be checked for the evidence of an accident. The indirect questions may be put to others, and discrete efforts to find out if anything untoward happened. Speaking about the alcohol withdrawal, it has specific term, the shakes. They may occur in anyone after excessive prolonged use of the alcohol. In full-blown alcohol withdrawal, drinkers are apprehensive, anxious, and easily startled. They may pace agitedly up and down the hall. Depressed mood and irritability are common. The tremor is quite characteristic, intends to be coarse, and is evident not only in the hands but also in the lips, tongue, and eyelids. In severe cases, drinkers may literally shake like a leaf, and by the unable to hold things or even at times to stand up. Diaphoresis, at times profuse, is often present. Most of the alcoholic, they have problems with concentrating, thinking, and remembering things. Also, fatigue is prominent, and people who have this alcohol withdrawal, they're unable to get asleep. Or even if they get asleep, they wake up during the night, they wake up very early, and the quality of sleep is very low. Headache, dry mouth, anorexia, nausea, and vomiting are common. Diarrhea may also occur. If we examine the temperature, pulse, the respiration, and the systolic blood pressure, they all can be elevated. The pupils can become dilated, and the deep tendon reflexes are hyperactive. Rarely, one may see the transient myoclonus, horriform movements, or Parkinsonism. It means that people sometimes have the tremor, the trembling, the shaking, and it becomes a huge problem for these people. In some cases, people may have visual hallucinations, illusions, or rarely few auditory hallucinations. In this do occur, they tend to appear in the withdrawal symptom, reach their height. In some people, during the withdrawal, they can have the alcohol withdrawal seizures. They are also known as RAM fits, and they are rare accompaniment in the alcohol withdrawal syndrome. They generally occur only after many years of heavy drinkers and repeated episodes of withdrawal, and seen from 1 to 3% of the people who are withdrawn from the alcohol. For the most part, alcohol withdrawal seizures present as otherwise unremarkable generalized tonic-clonic seizures. In about a quarter of the cases, however, the seizures can have a focal onset. If we are talking about the specific tonic-clonic seizures, we are talking about grand mal or big seizures. These seizures occur with the turning off of the consciousness, with the tonic stage of seizures, with the clonic stage of seizures. And we know that most patients have just one seizure. Occasionally, however, the patient may have the cluster of 2 or 3, and rarely as many as 6 seizures. And in some cases, we can see people who can have the status epilepticus. It's specific states that can lead to the death of the patient. The status epilepticus, it's some seizures that comes one after one without normal state of consciousness. And if the person have a lot of seizures, we know that it will lead to the tumor of the brain, and it has the same pathogenesis as the alcohol coma. The tumor of the brain can lead to the affecting of the centers of the heart beating and breathing, and the person potentially can die. So you have also remembered that alcohol seizures that are not the only one. They are the states that need the emergency help of the patient. Another state that typically occur in people who are withdrawn from the alcohol is delirium tremens. It is also known as the withdrawal delirium, and more commonly as DTS. It develops in the setting of the alcohol withdrawal syndrome and is seen in about the 5% of the hospitalized alcoholics. We know that typically DTS, it occurs on the 2nd or the 3rd day after the stop of taking the alcohol. Why are we talking about this amount of 5% of the hospitalized alcoholics? We are talking about this amount because if the person were drinking alcohol and for some reasons this person gets to the hospital, it can be surgical problem, it can be therapeutical problem or other type of problems. In this case, the person typically stops taking alcohol, and we know that this type of use of alcohol can lead to the withdrawal of it, and it can lead to the delirium tremens. It doesn't matter in which department you will work, you will see such patients because, as you see, there is 5% of hospitalized alcoholic. And if we will look on the statistic of the alcoholics, we know that almost 50% of people who are hospitalized in the hospitals, they are people that have problems with the alcohol use. It means that potentially you will see such patients very often. What are the main features of the delirium tremens? It is characterized by the gross accentuation of the tremor and autonomic signs, and by the development of the confusion, disorientation, and hallucinosis. The patients, they typically have disorientation in time and place, but the orientation in one person is present. The patient typically is agitated, have markedly developed tremor, very easily started, the mydriasis and the generalized hyperreflexia are prominent, as are such autonomic signs as diaphoresis, tachycardia, elevated blood pressure, and increased respirations. One of the main symptoms of the delirium tremens is visual hallucinations. They are very common, and they tend to be extremely vivid and complex. Often the patient sees insects or animals. Dogs circle the bed. Rats can that are trying to bite the patients, or they eat the toys of the patient. And bugs crawl on the arms and face. They may cringe in the fear or try to swat them away. At times, the patient may see simply a benign procession of animals, which he may watch from the beds, and if they were amusing procession. Curiously, one also often sees a predilection for hallucinations, strings, or threads. The patients may pick them out of the ear and warn the physician to avoid running into the stretched across the hospital room. Often, the visual hallucinations may be provoked by the suggestion. In the classic string test, the examiner holds the hands above the foot and half part and thumb and index finger suggestion. So we can tell the patient, please take this finger, and typically the patient have the DTS, he will see it. Even if the patient says that I don't see any string, you have to say, don't you see this string? Please take it. And in most of the cases, the person will take this string. Also, people who have delirium tremens, they can have the tactile hallucinations. As a rule, they may accompany with the visual ones, and the skin is ripped by the teeth, spiders bite, bugs are felt crawling all over. The patient may complain on electric shocks of pins being stuck into the toes. Also, one of the main symptoms of the DTS is auditory hallucinations. The patients may hear bells, whistles, or alarms. Sometimes they can hear the voices, and they tend to be critical, persecutory, or warning of dire events. Patients hear accusations of neglecting their children. The children are starving because the patients spend their paychecks on drink. The death sentence is pronounced. The physician is revealed as an executioner. Delusions are also common and tend to be persecutory. Murders outside the door, the nurse is bringing poison to the patient, other patients talk about and conspire against the patient. Disorientation always occurs, often in both time and place, as we were talking before. At times, this disorientation is enhanced by the hallucinations. The patient refuses the bedtime medicine offered by the nurse and announces that it is must be morning as the birds are chirping. If questions as to orientation to place, the patient seen in the clouds out the window may report being in the airplane or perhaps in the ambulance. Speaking about the memory, we can say that it is severely disrupted. The patient is unable to recall the name of the physician or name of the hospital. They recall of the events before admission is also often quite spotty. The behavior of these patients is commensurate with their symptoms. Some may sit tremulously in the bed, picking the bed sheets or brushing away insects. They may grasp in things in their ear and mumble agitatedly about events occurring outside the window. Others may strike, and at their persecutions they may attempt to escape through the door or jump through the window. In contrast, one may occasionally encounter quiet delirium tremens. Here, the tremor and the autonomic symptoms and the symptoms are minimal, and the patient or the white experiencing sometimes fantastic visual hallucinations may lie relatively quietly in the bed. One of the main things that you have to understand about the delirium tremens, that typically people who have DTS, they are extremely dangerous. They are extremely dangerous, not only to themselves, but also to the doctors, to the medical personnel, and to other patients, because the behavior typically depends from their psychoactive disorders. If the patient have voice that say that doctor is not a doctor, but he is very bad guy who want to take all your organs, potentially the patient can be aggressive and can run from the doctor or can hit the doctor. If the person believe who have DTS that the food is poisoned, potentially the patient can also be aggressive or will not eat. Or sometimes the patient want to prevent, for example, the taking of the soul by the devil, and can jump through the window or will try to hang themselves. So you have to remember about it, and all the patients that have DTS, delirium tremens, they have to be in the emergency rooms, in the reanimation department, and they must be under the observation. One of the main things that also occur in most of the alcoholics after years of drinking, it's alcoholic dementia. It's specific personality change. Patients become coarse and headless. They may become apathetic, and judgment is poor. Cognitive deficit eventually appears. Short-term memory fails, and the patients gradually have increasing difficulties in recalling the events of the distant past. Thinking becomes concrete. With continued drinking, the dementia may become profound. At times, minor cortical signs are seen, such as apraxia, agnosia, and aphasia. However, these are not a prominent part of the clinical picture. CT or MRI studies generally demonstrate the both cortical atrophy and the ventricular dilatation. Almost all alcoholics, they become paranoid. This paranoia is characterized by the delusions of jealousy, typically. The spouse is suspected of infidelity. The absences from the house are seen as proof of it. The spouse's desire to keep apart from the patients during the patient's intoxicated rages is seen as the mere excuse. Rules are laid down. The spouse is neither allowed outside the house alone, not allowed to speak in the private on the phone, and other pathological sins can be seen when this alcoholic paranoia occurs. When drunk, the patient may turn on the spouse, sometimes in the murderous fashion. In other cases, the illness may be characterized by the persecutory delusions. In some cases, the patient can say that the police have begun to hound the patient. Yet another change of driving under the influence of alcohol is trumped up. The unmarked police cars cruise down the streets. The neighbors have been recruited to spy on the patients from behind their shades. Occasionally, alcoholic paranoia can be accompanied with the hallucinations, but they typically play the minor role in the clinical picture of it. Footsteps and the sirens can be heard in the night, sometimes moves in the attic. The food can have the taste of spoiled, rotten, or perhaps sometimes poisoned. Strange people approach the house in the dead of the night. Almost all alcoholics can also have the alcoholic polyneuropathy. As we told before, that alcohol affects almost every organ and system in our body. The nervous system is also in this list. We know that, first of all, the alcohol can affect the nerves that are distant. As a rule, it's a distant part of the feet, it's a distant part of the fingers, and also it's the genitals. If we will look on the alcoholic, we can see that they have specific time of walking. They move specific way. They move like they don't feel their feet. We know that if we will examine these patients, we can see that the vibratory sense is lost first, followed by other modalities. The ankle jerks are diminished or lost, and Romberg test is positive. We know that almost all patients that continues drinking, they will have the motor weakness. This may be seen in a few as several weeks after sensory symptoms appear. Distal musculature is affected first, the lower extremities before the upper. Speaking about the second part of the lecture, we have to talk a little about the psychoactive substances. And speaking about psychoactive substances, not about the alcohol, we have to say that the most widespread substance that is used by people is caffeine. For example, we can say that the cup of coffee contains about 100 milligrams of the caffeine, and for example, tea has about 50 milligrams, and caffeinated soft drinks anywhere from 25 to 200 milligrams. And over-the-counter analgesic and the cold preparations, stimulants, anorectics, herbal products, and health food products may contain anywhere from 25 to 200 milligrams. Caffeine is almost completely absorbed, reaching the peak blood level in from 30 to 60 minutes. Metabolism is where the cytochrome P450 182 hepatic enzyme system, which is half-life ranging from 3 to 5 hours. We know that caffeine-naive patients, about 100 milligram caffeine produces an increased sense of alertness and decreases the fatigue. At doses between 100 to 500 milligrams, however, the caffeine intoxication begins. Patients feel apprehensive, restlessness, and even agitated, and complain of headache and insomnia. Tremor and tachycardia may also appear. At doses of about 1 gram, intense anxiety to the point of panic occurs. The agitation may be extreme, and the tremor and tachycardia are quite prominent. Premature beats and muscle twitches may occur. Significantly higher doses may produce a serious arrhythmias such as ventricular fibrillation, grand mal seizures, and respiratory depression and the death. Provided that no further caffeine is ingested, the symptoms of intoxication tend to clear in the matter of hours, and recovery is generally complete within 6 to 12 hours. Neuroadaptation may develop after the daily use of only 500 milligrams of caffeine over a couple of weeks' time. Tolerance is manifested by the ability of the patient to consume without ill effect doses of caffeine that would cause intoxication in caffeine-naive individuals. Withdrawal tends to occur in 12 to 24 hours after the last dose and is characterized by the headache, poor concentration, fatigue, anxiety, irritability, and depressed mood, all gradually clearing in from 2 days up to a week. I want to tell you one story. A few years ago, when I was writing my second dissertation to become a doctor of medicine, I had such a case. I like tea for many years. I drink strong tea, and I was enjoying drinking tea for years. tea is one of the most tasty was one of the most tasty things in my life. And I was the only one person in my department at home who were drinking the tea with with sugar. All people that drink tea, they say that sugar, it decreases the taste of tea. And for many years, people were telling me, please, you have to leave drinking tea with sugar because sugar, it wastes the taste of tea. I ignored it. But one day, my friend told that if you enjoy drinking tea, you have to stop taking sugar, and potentially after a few days, you will enjoy the taste of tea. And I thought that, okay, I will leave the sugar, and I don't want to drink the tea with the sugar because I like the taste of tea. One of the information that was given to me by my friend was that previously he also liked to drink tea with the sugar, but now when he even tried the tea with the sugar, it's awful. So he enjoyed drinking it without sugar. So I stopped taking sugar. I were doing it, I don't remember, maybe months, maybe month and a half, and I understood that I don't enjoy drinking tea with the without sugar, and I wanted to give some sugar to tea. I thought that my taste will ignore absence of sugar, but I didn't adopt, and I think that I will go back to the taking sugar to the tea. After trying tea with the sugar, I understood that it's not tasty. At that moment, the tea was not tasty without sugar, and it was not tasty with sugar. So I understood that it's better to drink. It's better not to drink the tea at all because I don't enjoy it anymore. So I stopped drinking tea in one day. But it was not the best days because in a week I had to have the presentation about my doctor dissertation. It were like extremely necessary scene in my life, and I had to do it very well because my future depended from this event. When I were trying to teach the materials, I understood that I'm unable to do it anymore. So I were not able to concentrate. I was not able to memorize things. I was not able to think logically. I were like the person who is like totally unable to do anything. I were doing it for 3 or 4 days, and I was not able to memorize anything. And I understand that in 3 days I have the presentation of my work, and I have to know something, but I didn't know anything. And at the time, I even think that maybe I have the first signs of the dementia. It's like acquired mental retardation. Then one evening I came home and I were preparing tea for my wife, and I understood that I didn't drink tea for a few days. I made the tea for myself. I drank the tea, and it was like it in one day, my cognitive processes, they appeared again. And I understood that I were dependent from the tea. So if I didn't drink the tea at the time, I will not be able to give the presentation to a lot of professors, and I will not be able to be like professor in the future. So I understood that these processes of neuroadaptation, these processes of withdrawal, they are extremely necessary for understanding. And if I'm talking with you like with the future doctors, you also have to understand it, because most of your patients, they will take psychoactive substances, they will take the medications that potentially can have the withdrawal symptoms. You potentially can use the alcohol, the caffeine, the tea, or other substances, and potentially you have to remember like this story, like a fact that potentially can give to you ability to understand what can happen if you will stop taking psychoactive substances. Speaking about all psychoactive substances, we can say that they can be divided into three main groups. It's psychostimulants, it's psychedelics, and depressants. Psychostimulants, they increase the work of the speed of work of the brain. They increase the memory, increase the speed, they increase the energy, and the person who use the psychostimulant have feeling of superhuman. The thoughts become quicker, the mood become higher, the person have a lot of energy. People use it to work more. The opposite group of psychoactive substances, it's depressants. These medications give one main sins that become the reason of the use of them. It's euphoric effect. Euphoric effect, it's effect that when person feel very good without any specific reason. And the third group of substances, it's substances that are used because people like the effect of changing the consciousness, changing the ability to think, changing the ability to perceive the information from the external world. It's psychedelics, or substances that changes the consciousness. So if you're talking about the psychostimulants, as a rule, we are talking about the amphetamine, cocaine. Depressants, it's poppy flower substances, it's opioids, it's benzodiazepines. And speaking about the psychedelics, it's like cannabis, LSD, psilocybin. And you have to remember one main thing about the use of psychoactive substances. Every person who starts taking psychoactive substance potentially can become dependent from this substance. And if you believe that you can control this use of psychoactive substances, I can tell you that nobody can control the use of it, because it's more strong than any person. And potentially, if you will use psychoactive substances, you can have a lot of negative effects that not pleasant for anybody. So before use of psychoactive substances, you have to think. Thank you for your attention.